Good morning. In this session, we are going to try and discuss what are the complications that people get after they have recovered from COVID. So, in order to understand what kind of complications people get and why they get it, we have to understand what actually happens in COVID. So, COVID comes in a wide spectrum. On one side, you will have a totally asymptomatic individual, and on the other side, the patient will develop severe pneumonia or ARDS, also called acute respiratory distress syndrome, wherein the entire lungs get involved with a pneumonia and the oxygen level drops down. So initially they need maybe 1 or 2 liters of oxygen. Some patients will get as high as 30 to 40 liters of oxygen. A small proportion will go on a ventilator, and a very small percentage of patients may not survive also. But when the patient starts recovering or resolution takes place, the pneumonia in the lungs starts settling down, the oxygen requirement comes down. And when the oxygen requirements become zero, that is, the patient does not require oxygen for a period of 24 to 48 hours, then the patient is considered recovered and the patient is discharged. But does that mean that the pneumonia has completely settled down? Definitely not. Even at the time of discharge, the patient lung has got some amount of pneumonia remaining. What else happens in COVID? Inside the body, just like we discussed, there is inflammation or swelling in the lungs. There is inflammation and swelling in the muscles, which is called myositis. In the heart, which is called myocarditis. There will be inflammation or swelling in the liver, in the intestine, sometimes in the pancreas, and a very small proportion of cases, the brain can get inflamed, which is called meningoencephalitis. So when the fever settles down, when the appetite is okay, when the oxygen requirement becomes zero, when the course of antiviral is over, the patient is sent home. But that doesn't mean that the myositis, the muscle inflammation, or the lung inflammation has totally settled down. That is going to take another 1 to 3 weeks to completely settle down. And that is why when the patient goes home, the patient feels that he has completely recovered, but there is some amount of inflammation going on inside the body. Another thing that happens in COVID is the tendency to form clots. There is a lot of what is called microthrombi or microclots which is there in the lungs. That also causes impairment of gas exchange and oxygen requirement to the patient. In the same way, there is a tendency to microclot formation in the entire body. That is why the blood thinners are given in therapy. So now, having understood what happens in COVID, let us see what are the common complications or problems that the patient gets once the patient kind of recovers from COVID. The most common complication or symptom is fatigue and weakness. And why does this occur? This is because the muscles are still inflamed, the liver is inflamed. Imagine that a swelled up muscle, a muscle with myositis, is still present in the body and you are trying to walk, and that inflamed muscle will cause extreme fatigue and weakness and body aches. And the liver detoxifies everything in the body, and that's why, since the liver is also still inflamed, that also adds on to the fatigue and weakness. And that is why you get this symptom of fatigue and weakness, which is the commonest. And the entire inflammation of the muscles, liver, etc. will take 1 to 3 weeks time, and that's why the patient will take that much time to recover. Second most common symptom is breathlessness and cough. Now, what we said, the pneumonia has not completely settled down. So there is some degree of inflammation in the lungs. There is some degree of microclots in the lungs also. And that is why when the patient goes home and tries to walk a bit, the patient becomes breathless. Typically, many patients complain of air hunger or wanting to take a deep breath after, every few minutes or so. And especially when they talk, they are forced to take a deep breath because the oxygenation is still impaired, because some degree of ARDS or pneumonia or inflammation of the lungs is still present in the body, and that's also going to take 1 to few weeks to completely settle down. Now, what we discussed was the tendency to form microclots, and that is why if the patient has either not been given blood thinners or has omitted the blood thinners, then the patient might develop clots somewhere in the body. If the clots develop in the brain, some patients, this is very rare, but some can develop a stroke after discharge. If it develops in the heart arteries, he can develop an ischemic heart disease or a mild or a major heart attack post-discharge. So these are the complications that occur in a patient post-discharge, commonest being the breathlessness, cough, weakness, fatigue. Some of them develop a cardiac problem or a brain issue, and some of them can also develop intestinal problems like gastroenteritis because the intestines are inflamed. Another problem which occurs is because of the therapy per se, and we all know that steroids have to be given in the therapy of COVID, and because of the steroids the blood sugars can go high, and therefore you can have a COVID patient who may be a diabetic and the blood sugars become very high post discharge, and you will have some complications related to high blood sugar. Steroids can also cause increase in blood pressure, so that can be a complication post discharge. Prolonged high dose steroids can cause some weight gain, some fat deposits on the face. So classically some patients come with swelling of the eyes and swelling of the face, etc. But that settles down when the steroid therapy is tapered out. Now these are the symptoms that can occur in a patient which who has recovered from COVID. So what do we do about all these things? That is why it is very important that after the patient gets discharged, he or she has to take a sufficient period of rest. It is to allow the muscles and the liver to recover, and also take enough amounts of vitamin supplementation, maintain good hydration, and do a graded gradual exercise to come back to normal. And that will help the fatigue and weakness. Many people go home and just stop the multivitamins altogether, and they don't take rest, and they try to go somewhere maybe 3 or 4 days after getting discharged, and they land up with severe fatigue and weakness. That is something that you should avoid doing it once you have recovered from COVID. Secondly, for microclot formation, if your doctor has prescribed you blood thinners, which is prescribed in some cases of mild and almost all cases of moderate and severe COVID, a blood thinner will be prescribed for a period of 10 to 15 or days or longer than that. It is very important to take these blood thinners properly so that the problems of clotting in the heart, which can lead to a heart attack, in the brain, which can lead to a stroke, these complications are prevented. The third important thing is that you have to exercise your lungs. So initially during the period of COVID, because the lungs are inflamed and there are microclots in the lung, the breathing exercises are not done when the active COVID is going on. But when the COVID starts recovering, that is the time where your doctor will tell you to start doing some breathing exercises. And that breathing exercises will improve your lung capacity, will improve your breathing muscles, and therefore the problems of breathlessness and dry cough will start coming down. So it is very important that post-discharge does not mean that you have recovered completely. Recovery from COVID is going to take 2 to 4 weeks. And even in totally asymptomatic individuals, there is some degree of inflammation in the muscles, in the lungs, etc. And that is detected if we sometimes do a blood test. The patient says, I am totally asymptomatic. The blood test might show that the CRP level is slightly high, or another test called D-dimer, that is slightly high. And that indicates that some degree of inflammation is going on in the body. So even in asymptomatic patients, it is very important that they take some rest, they maintain hydration very well, they take some multivitamins, and they do a graded exercise to come back to normal, along with a proper, well-balanced diet. I hope this session has proved helpful for all of you. Thank you very much.